begin to have trauma. With COVID, I was thinking, and I was reminded of when I was just a baby nurse. I know I wasn't even 30 yet, and I was a clinical director on a unit that was basically run by Harborview Medical Center, and they were trying to move people out of the regular hospital into these step-down units. But these people were really sick, and many of them were dying of end-stage AIDS. I, at that time, didn't really know what I was getting into. And once I did, I was already in the midst of it. And I never really had opportunities to process everything that I had seen or been a part of, or the journeys that I had been on with people. Then with COVID, it brought me back where I could explore that time again. And this is what I wrote. And it's called The Bruise. Later, I would show the bruise. The job, a place where vivid young men died in alienation. But then I had nothing to lose. So many would take a stance. They would accuse, come to fearful, unfounded conclusions about the contagion. Later, I would show the bruise. The virus didn't care or excuse. Lung, gut, blood cells and heart, brain and early vegetation. The breath, the last thing to lose. Emaciated, Gandhi-like face, hospital gown, no shoes. Behind smeared glasses, fright-filled eyes seeking explanation. Later, I would show the bruise. Lack of staff, morale, training, supplies, no good news. There was never good news. No cure, no hope, no vaccination. There were so many deaths, a multitude to lose. Later, I would show the bruise. A man dead of a disease he did not choose. His loved one gripping my shoulders with frustration. Later, I would show the bruise. Later, I found out I too had much to lose.